Bismillahirrahmanirrahim. Assalamu alaikum and welcome to this Saturday's edition of Let's Talk, coming to you from our Sunning Hill studios in Johannesburg. It's great to be with you, and we have two great guests in studio with us. The first one is a chiropractor, and the second one is here to talk about her company. She's the CEO of the Teen Geeks. So lots of interesting stuff coming your way, and I think both the interviews are going to offer you an opportunity to perhaps follow your passion. If you haven't yet decided the profession that you want to go into or the field of study that you want to go to, then there is still time, and perhaps you want to watch these interviews closely and see if it's going to mean anything for you, if it's going to tickle your fancy, and if it does, then perhaps this is where you should be focusing your attention on. So chiropractic is the first interview, and it is with the lovely Desiree Grissel. She has a practice in Linden, Johannesburg, and let's talk to her about her passion. She says it's her passion, so her passion is being a chiropractor. Desiree, good morning, welcome to the show.
Thank you for having me.
Lovely to have you here, and it's wonderful and heartwarming to talk to someone who is so passionate about what they do. And you've been talking about your profession with much love. It shines through, your eyes light up when you talk about it, and that's great to see. And I know when people are that passionate about their work, they give it their all. So where, when, and how did this passion start for you?
So I grew up in a family that my dad was a doctor. So in the healthcare profession was always very close to my heart. So I knew I wasn't going to do an office job. And I think God just directed me into a path that He led me to chiropractic, and I knew that that's what He wanted for me, because I applied for medicine and physiotherapy and speech therapy, but everything was just turned down, and the only door that opened was chiropractic. And I absolutely love what I do.
Now, when you were turned down for the other, obviously the other professions or the other fields of study that you applied for, and chiropractic was the only available avenue left to you, did you not feel cheated?
Not at all. So my first choice was chiropractic, but because of my dad being a medical doctor, I always tend to want to follow in his footsteps. Then I decided not to study chiropractic as my first choice. But after I took a year, so I took a break after school. I did evangelism for a year. And after that year, I reapplied for chiropractic. And that was literally the only door that opened. I feel that God just directed me on this path, and that's where I am. And I'm so happy where I am today.
Now, you've been in practice for over a year, am I right?
Yes.
And you in your own practice for about 6 months. So good luck. I hope things grow from strength to strength.
Thank you.
Let's understand what exactly is it that chiropractor does.
So if you look at the word chiropractic, it actually means it's done by hands. So we are a healthcare profession that specializes in the diagnosis, treatments, and prevention of any disorder related to nerve, muscle, and joints. So we are neuromusculoskeletal, so I want to say specialists. So if you identify that you've got knee pain and you know that it's a joint, you know that you can go to the chiropractor. Or if you've got a muscle pain, or you sprained your ankle, or you strained a muscle, you can go to the chiropractor for that. And also if it's a nerve-related condition, let's say for instance you get pins and needles running down your arm, or you've got a numb sensation on your leg, you can also go to the chiropractor for that. So that's what we do.
It is said that headaches and chronic back pain or back pain are the two biggest reasons for why people stay away from work or take time out and just try and recuperate. Would you agree with that?
100%. A lot of people suffer with chronic migraines or headaches. It's mostly actually due to posture and bad support at desk sitting, because a lot of people have desk jobs and they're sedentary for a lot of the hours during the day. And that's also where the back pain comes in, because they don't have enough lumbar support to support them. And then it's also probably due to weak muscle that keep them away from work, because of that presents with the pain, the headache and the back pain.
Now, chiropractic is an alternative practice, is it not?
Yes.
Because I'm now thinking physiotherapy, everything you mentioned, one could go to a physiotherapist for that as well.
Yes.
Why would I opt to go the alternative method and go to a chiropractor? Would I get similar or the same results going to you or to a physiotherapist?
So that's a very controversial topic, but the truth is we actually do offer a lot of the same form of treatments and modality of treatments. But what identifies us from physiotherapies is that we are we were like spinal manipulation specialists. So we manipulate the joints, whereas physiotherapy, that's not their specialty. So we are trained to actually feel how the vertebral bodies move and how they are fixed or restricted into certain directions, and we'll actually manipulate that back into place, restoring movement in the body, restoring the mechanical function, and then also stimulating the nervous system, whereas physiotherapists are more soft tissue therapists.
All right, before we get to some more on chiropractic, let's understand, where is this course being offered and how long does it take to become a qualified chiropractor?
So a lot of people don't realize how long it is and how much effort you need to put in to be a chiropractor. So it's offered at the University of Johannesburg and the Durban University of Technology. It's a 6-year course.
What?
And
oh goodness me, I thought it was a 3-year course.
So we're doctors. So within
Almost.
that 6 years, yeah. So within that 6 years, the first 3 years is very similar to medicine. So we cover the subjects of anatomy, physiology, chemistry, biology, and medical microbiology, biochemistry, immunology, epidemiology. So we cover all that medical subjects within our first 3 years. And then we're also in our second year, we actually do full cadaver dissections. So we've got full anatomical knowledge. Then within your 4th and your 5th year, you do more clinical chiropractic stuff. So you go more into spinal manipulative therapy and more how to diagnose musculoskeletal conditions. And then in your 5th and your 6th year, you need to complete a thesis in order to qualify as a chiropractor.
So what was your thesis on?
So the topic of my thesis was activated trigger point therapy versus interferential current in the treatment of interscapular pain due to rhomboid trigger points. So I kind of divided up because it's 2 different modalities which I compared within the study of getting interscapular pain.
Okay, now let's look at the issue around coming back to chiropractics and your obviously your practice, you're now running for the past couple of months. We touched on headaches and backaches. Would you say those are your 2 main focus areas, or are there other areas that a chiropractor would treat as well?
So what we mostly see in practice is people complaining of back pain. I think as the olden days and how the profession evolved, we were known as the back specialists. So that's how people identify us as, I've got back pain, maybe I should go to the chiropractor. But when it comes to normal conditions, as in sports injuries, what's actually quite interesting with that is, let's use your ankle sprain as an example. So I'm going to use my hand just to explain this. So if you've got an ankle sprain, your ankle usually opens up to the side, and that's how your ankle, well, let's use the left, it actually opens up to the side. So your ligaments attach from bone to bone. So as soon as you open that up, the ligament gets lax, so the bone actually moves. So if you sprain your ankle, it is actually quite good to go to a physiotherapist. They do phenomenal work when it comes to acute swelling, pain management, and how to get everything restored. But what's missing is the fact that we need to realign those, your talus and your calcaneus in your ankle to actually reinsure that if that ligament regrows and heals itself, that it heals in a normal, in a normal and correct anatomical position. So we're not only back and headache specialists. There's a lot of chiropractors that actually went to the World Games treating injured athletes there. And even athletes like Usain Bolt and Tiger Woods, they used chiropractic care on, I want to say, weekly basis, because it actually helps with preventing of injuries. Because if you have I want to say mechanical malalignment in either your knees, your ankles, your hips, your pelvis, everything actually goes all the way up to the spine, because your body is a chain of mechanical reactions. So if there's something wrong with your knee, you might get actually back pain on the opposite side due to compensation of the pelvis. So we prevent injuries like back pain in athletes to come on if we look at all the joints and we realign all the joints in the body to make sure that your body is in full mechanical functioning.
Talking about bones, and this might obviously be out of your area of expertise, but you might have a little knowledge on this. A lot of older people go for hip replacement operations.
Yes.
How do you understand that condition? And I know that you're not involved in surgery, but in terms of hip replacement, what is it that goes wrong that they need to have knee or hip replacements? I've even heard recently of ankle replacements.
So I think it's mostly due to degeneration. So there's a lot of, I want to say, either an autoimmune condition in the body, let's say rheumatoid arthritis, that actually affects those joints. So as soon as there's bone deformities, I think it's past something that chiropractors treat, and therefore you need a hip replacement. As soon as the bones go past, I want to say, their normal anatomical position or their normal anatomical formation, that's where you need a hip replacement. Also, when it comes to fractures, because mostly all the geriatric patients, if they fall, they need to get a hip replacement. That's mostly due to the fractures in the femur. So if it fractures past, I don't know, some certain degree, they need to get a hip replacement because firstly, due to old age, fractures don't heal as well. And secondly, they'll never be able to walk normally due to the fact that there's degeneration in the joint already. So the joint is compensated already.
Okay, we're going to talk more about bones, replacements, and perhaps even osteoporosis in a minute or two. Let's take our ad break. I'm talking to the lovely Desiree Grissel. She is a chiropractor. She practices in Linden, Johannesburg, and of course, that's what we're focusing on this morning. And to all of you matriculants, if you haven't yet decided what you're going to do with your life post-matric, maybe you've taken out a gap year, then this is something perhaps you want to think about. Still to come on the show, we're going to be talking to Africa Teen Geeks, but let's take an ad break. When we get back, we're going to further enhance this topic on chiropractics. Desiree Grissel is here to talk to us about chiropractics, and we do hope that you're finding this informative, and who knows, maybe this is a career path that you need to be following. But do stay with us. We're going to talk some more about chiropractic. Before the ad break, Desiree, I asked you about patients or people who come to you for manipulation or whatever, but they suffer from osteoporosis or they may be osteopenic. Do you treat this patient differently, and are they safe in your hands?
Yes, they are safe. So that's what a lot of people need to understand, that if a patient approaches me or come into my practice with a problem, I try everything to help that patient because I'm so passionate, firstly, but also we are equipped to treat patients from all different walks of life with all different conditions. So when we approach an osteoporotic patient, we won't use full force manipulation on that patient, seeing that there are a risk of fractures, especially in the T-spine, and we don't want to fracture anything like a rib because that's uncomfortable breathing. So we'll use more alternative modalities or more safe modalities. So
for example?
Yeah, so our beds are actually equipped with drop pieces. So it gives you a little bit of a more amplitude with less force. So if you want to manipulate that patient, you can use a drop piece with less force and more amplitude that gives you that drop to try and realign that bone. And also we get equipment called an activator. So it's like it almost looks like a little gun. It's like it works with high speed. So if you release it, it actually works with a high speed going into the bone. But because it's not a lot of force, it actually lessens the fracture, the chance of getting a fracture.
Now, I know you talk about spinal manipulation, and there's also the issue around the neck. You work on, the head and the neck. But there's also, again, and this might be a myth, I don't know if it's a myth or a fact, but people are actually afraid that if they come to you for manipulation, you may break their necks.
Yes.
So what, is that a myth or is that an actual fact?
No, it's a total myth. Everything you see in the movie with people adjusting necks, twisting necks, and the guy falls dead, it's not true. It's physically not possible. So if you look at the anatomic or the anatomy of the vertebra of your neck, it's designed in such a way that you cannot push it further than in what we call an anatomical limit. So if I want to be able to push your neck or manipulate your neck past that anatomical limit, I need to actually use the force or torque to move a 450 kilogram piano with one arm over 30 centimeters. And I physically do not have the capabilities to actually move a piano with one arm in like 2 seconds. I don't have that capabilities. But I think the other risk that people are aware of is that if you use neck manipulation, there's a chance of getting a stroke. So this is
that true?
Yes.
Why would that happen?
So what I want people to understand is that if you go to your hairdresser or Thai massage therapist, please do not get a neck manipulation from them. There is a risk that you might get a stroke, and they are not equipped or trained to actually examine, to see that you might have that risk, or to even understand which direction the bone should move. So anyone can manipulate, but to manipulate in the correct way is also very important. But when it comes to the stroke, so you've got an artery that runs on the side of your neck in your transverse processes of your vertebra that actually feeds the brain. So if that artery is compensated, maybe the edge of the artery is dissecting, what we call a vertebral artery dissection, so it lifts. If you manipulate that neck, you can actually cause a stroke because of that close relation of the artery and the brain with neck manipulation. So I do suggest, if you want to go to a Thai massage therapist or a hairdresser that wants to manipulate your neck, please stop them immediately, as they are not medically trained to identify if you are a risk for a stroke.
What's the difference between, you keep talking about manipulation, and you're also referring to the hairdresser and the Thai masseur. What's the difference between manipulation and a massage? Is it one and the same thing?
No. So massage is more soft tissue related. So it's more to induce blood flow, actually realign muscle fibers, getting more into muscle relaxation. Whereas manipulation is a lot more mechanical and joint and bone related. So can I just explain to you?
Of course.
So use your spine, for example, seeing that is basically the main thing we focus on apart from all the other joints. So if your vertebrae are aligned on top of each other, obviously we are designed that it should be in normal alignment, but because we fall and we sit skew and we, I don't know, get out of the bed with the same leg every day, things in our body move. So even if it's just a few millimeters, that bone moves out of place. We use manipulative therapy to adjust or manipulate that bone back into its correct alignment. That's why I'm saying anyone can adjust, anyone can click their knuckles, anyone can click their back, but to get that bone back into the normal anatomical alignment, that's the important part. Because if you keep adjusting or manipulating as the bone that's out of place, and you manipulate, and you're not trying to actually realign that bone completely, you can actually cause early degeneration and joint damage in that joint, because you're not moving the bone into the correct place, you're actually just damaging it further out of its correct alignment.
The chances of someone getting paralyzed, becoming paralyzed after going to a chiropractor,
it's very slim. Right. The techniques we use are very safe, and we trained very well, so it's very slim.
6 years of training.
Yes.
You also find people, and I don't know if that's the manipulation we're talking about, but you sometimes see people kind of, pushing or trying to get your head into alignment, and they move your head from side to side, and you sometimes hear cracking sound. Yes. What's that all about, and how safe is that?
So that's what I explained just now. So to get normal alignment is where the skill comes in from being a chiropractor. I can teach you. You
don't let other people do that.
No, because I can teach you the technique, but you need to know what you're feeling, how the movement is restricted, and how the joints are not moving in the spine. And then when it comes to the clicking, so as your joints are on top of each other, on the side you've got small joints called your facet joints. Those joints are encapsulated with a small little capsule, and inside that capsule is a fluid called your synovial fluid. So that fluid is there just to nourish the joint and make sure everything works well and that it's a healthy joint. But a byproduct of that fluid is a gas. So as soon as you actually move that joint or stimulate that capsule to just move, it's actually the gas in that joint that releases. And that makes that popping or cracking sound.
Okay, yeah. So it's no bones that are cracking. All right, let's go for our next ad break. I'm talking to Desiree Christel about chiropractic. And I didn't know that it was this intense, that you actually spent 6 years studying this modality. And despite all the myths we've been hearing about chiropractors, I'm glad she's here so that we can start looking at them differently and accepting them as the true professionals that they are. Don't go away, we're going to be talking to her some more after this ad break. Standing by. We're talking chiropractic with Desiree Christel, and of course we're trying to uncover everything you've ever wanted to know about chiropractics. Back to you, Desiree, we've covered a lot. What about, I've heard the term herniated disc. Now, what is a herniated disc and what do you do to fix the patient?
Okay, so once again, I just have to explain the anatomy
course,
to
go
understand
ahead.
the condition. So between your two vertebral bodies, you've got that what we call the intervertebral disc. So it actually consists of two components, the outer layer, which is your annulus fibrosus, and then on the inside you get the nucleus. So as soon as there's any compensation in the fibers of the annulus fibrosus, this nucleus actually protrudes through the annulus fibrosus. So that depends on the stages of the disc herniation. So either it's a disc bulge, a prolapse, a herniated disc, or a sequestrated disc. So up to the stage where the disc is only herniated. So that means the nucleus has moved out towards the outer parts of the annulus, but have not actually broken off and drifting in the spinal cord. It's just still encapsulated, but it actually can push on the spinal cord, or it's still within
And
the
create a lot
annulus.
of pain.
Yes, yes, a lot of pain down the legs or down the arms. So up to the point where that nucleus is still within the I want to say the borders of your annulus fibrosus, we can actually treat that disc, even if it's a little bit protruded to the outer, but it have not broken off.
Through manipulation.
Yes.
Purely manipulation only.
Or distraction. So that's also a form of traction, which our beds are actually mechanically able to do. So the bed distracts, and then it actually, distracts, that's the right word, and then it flexes up and down to cause an opening in the joints, to try and cause a negative pressure to actually suck that nucleus back into its encapsulated, I don't want to say space, from the annulus fibrosus.
At what point would you refer the patient to a doctor or an orthopedic surgeon? I mean, I should imagine there is a point where you can't do anything more for the patient. What would that extreme condition be?
So, for example, a sequestrated disc.
Which is?
The part of the nucleus that has moved out, broken off from the rest of the nucleus, and that is drifting within the spinal cord. That needs to be removed surgically. But we usually differentiate whether we can treat a patient up to the point of referral with physical examination firstly, and then with your orthopedic testing, and then just how the patient responds towards your testing or towards your pickup on history like case taking, or then just if you're maybe treated the patient once or twice, how the patient responds, and then you'll identify whether this patient needs something more, or you just need to be patient and this patient maybe just be a little bit less responsive. Well, I think it's more a decision from the chiropractor itself, but we are
or
trained
a joint
well.
decision between you and the patient to decide how much further you carry on with the treatment.
Yes.
Is it possible at any point in time with your super sports people that you find a chiropractor and a physiotherapist working almost simultaneously with the sports person to get them to optimal level of fitness? And what would the condition be? And is that a possibility?
That is a possibility to work well, and I think it would actually make a dream team, seeing that what they offer and what we offer, if we all focus on our own specialities, if they release soft tissue well and we do all the mechanical manipulation, it could actually be the perfect team, seeing that we alleviate each other's work. Does that make sense what I'm trying to say?
Absolutely.
So let's think of a simple example like a hamstring strain. So if the patient had a hamstring strain, they would go to the physiotherapist first. They would maybe do some acute swelling management, pain management, get rid of the bleeding, make sure the muscle fibers are realigned. And then when they come to us, we'll look at ankle, knee and hip mechanics to see where that problem came from. Maybe it was from a supination in the ankle or pronation that actually causes mechanical effects all the way up to the hip, and then we'll correct that mechanically. So I think a physiotherapist and chiropractor could actually be a dream team.
Okay, you talk about pronation, obviously talking about the way people walk,
yes.
their footfall. How important is that? Let's assume, again, it's a sports person or someone who's wanting to take running up as a sport, or is just having lots of problems with back pain, side pain, etc. That would indicate that it's the way they're walking or the type of footwear that they invest in that's creating all of the problems. Would you be able to direct them and do a couple of sessions with them?
Yes, so if we do a full physical examination, we can actually identify whether the patient is pronating or supinating. But usually what I do from my personal experience is if I get a runner or a sports person, I usually ask them to bring in their shoes. So we can see what the tracking is on the bottom of their shoes to see whether maybe they are stepping a little bit towards the outside on the right foot, but more towards the inside on the left. Then we actually assess mechanics in a standing position, in a walking position, and even sometimes in a running I want to say, it's not a position, but a running fashion.
Yeah.
So we see how they run, what may be drops, what may be weak, and then we assess that and we correct that mechanically. And then also that's where we work well with biokineticists to strengthen the weakness we picked up in our assessments. Because if you have a weak, let's say, left quad, you're always going to have to tend to have like maybe a drop in knee in your left. So we have to strengthen that, correct your ankle, knee and hip mechanically, and then where the biokineticist comes in and helps to strengthen that complex.
What about prosthetics? Do you ever refer them on maybe to a podiatrist or whoever just to maybe get the correct footwear or the correct inners?
Yes,
like
we do. Yeah, so I had a patient who had shin splints and she had a lot of pronation, but she was also a dancer. So her foot flexibility was out of this world. Like, I was not used to that. You will just turn her feet and it will just go all the way. So a patient like that do need to get insoles just to stabilize the bridge a little bit, to make sure that if she steps, the step doesn't go too far in onto the medial aspect of the legs, and then it just lifts it up and it supports the legs all the way up.
And basically what we're saying here is you need those prosthetics for, obviously, for balancing. If not, then the patient is going to be compensating in some other part of their body, and it's going to create a lot of pain or calluses or whatever have you. We're almost coming to the end of the show. Let's talk about, and again, we're touching on myths or facts. Issues around, I've been told that babies who suffer from colic, I'm talking little babies here, that the best thing that a mom can do with this little newborn baby that's screaming murder, blue murder, is to take the child to a chiropractor. Why?
So what happens these days is South Africans, actually more than any other country in the world, we tend to get C-sections upon delivery. We tend to not go the natural way. So usually if the baby gets a natural delivery, they go through the birth canal, and that actually gives them a little bit of a normal alignment, which is good. And I think that's the way our bodies are designed to work. But because of technology and risks involved with delivery, we tend to choose the C-section way. So what happens is that baby gets pulled and tucked and sucked out of that poor mommy's stomach, and that baby goes through a lot of birth trauma. So what that then leads to is spinal dysfunction in that poor little baby, and that tends actually to cause the colic, because the baby is in extreme pain and they can't utter the words to tell you I'm in pain, so they just keep screaming because they're uncomfortable lying down, lying on their stomach, looking over their left shoulder. So it depends where the mechanical problem comes from. But if you release the spine and the neck of that baby, they respond phenomenally.
Now, they're little babies with very soft bones at this point. What is it, and how do you work with them without possibly causing any more, causing alarm, number one, or causing any further damage to the poor little mite?
A shame. So babies are, their spines are actually not full bone yet, so it's actually cartilage. But when it comes to the spinal dysfunction, you actually only use 2 fingers when you treat babies. So it's a lot about feeling where that bones are restricted, and it's actually just a slight pressure you use to adjust babies, or just a more mechanical swing. But it's very subtle and very soft, so moms have no need to be scared.
My word, how fascinating. And I've been told that it works every time.
It does.
And if it doesn't, in a situation where it doesn't, then obviously you refer baby on, because then that indicates that there's something more seriously wrong with baby.
Yes, maybe a wheat allergy or something like that. So it could be more of a digestive thing than it is a mechanical thing.
Right. Yeah. And to wrap up then, let's talk about challenges in your profession. What would they be?
So the main challenge, I think, is that the misconception of the public has of our profession. So in the olden days, it used to be very, I want to use the Afrikaans word, ruk and pluk. It used to be very invasive and
pull and tug.
Yes, very pull and tug and hard and forceful. Whereas if you look at the chiropractors today, the profession itself has modernized and evolutionized a lot. So if you look at the type of people that practice chiropractic, it's not just big guys that are chiropractors. You get tiny little girls that practice chiropractic, and it is actually
with great
doable.
Results.
Yes, because it's all about the technique. So the technique has evolved so much that it's not as forceful, and you need a lot of strength to be able to do it. If you've got the right technique, you can basically adjust anyone. So that's actually a good thing. And I want the people out there to understand that chiropractic is not harmful and hard and painful, that it actually helps you a lot.
If someone comes to you, someone with chronic back pain, how many sessions, and I know it's a very general question because it differs from patient to patient, but how many sessions would they have to come to you for how many sessions before they can get some form of relief, or would they get results almost immediately?
So the thing about getting a spinal manipulation, so if your bones have been misaligned for
a long
time, let's say a few years, that's what we refer to chronic back pain. If we realign that joint, it's almost as if that joint, I don't want to say sprained, that's not the right word to use, but that joint has moved. Now things are a little bit irritated around that area. So you do feel almost, I want to say, an immediate response in range of motion. So let's say, for instance, you weren't able to look over your right shoulder. You can now look over your right shoulder, but with a little bit of pain. So we have post-treatment tenderness that comes along with our profession. So if you come for spinal manipulation, you might actually feel a little bit worse before you get better. It's just because we induce inflammation and we realign things. So your body thinks to itself, why am I feeling like this? Why did I move like that? Is this normal? Is that normal? So the body needs to adjust to what we just adjusted. And so that's where you can actually have a little bit of pain after treatment. But when it comes to the amount of treatments, like you say, it's very general. Depends on the pathology and the type of diagnosis we made. So if it's a disc herniation, some people respond in 3 treatments, some people only respond in 6 weeks. So it also depends, it's literally patient dependent, how healthy they are, how active they are, do they cooperate with the stretches and the exercises you give them. So it's very general, but I personally treat my patients 3 to 4 times. If after the 4th time I don't get results or I don't see the patient has improved a lot, I try to see what other aspects we can use, as in a referral maybe to a biokineticist, a neurosurgeon, orthopedic surgeon, just to see what's going on.
Would it help you at all if a patient came to you with x-rays? So I come to you with chronic back pain and I come to you with my x-rays as well. Would that help you at all in diagnosing and understanding when, how you start treating me?
Yes, so we love x-rays, and some chiropractors in South Africa are privileged enough to have x-rays within their practice. So they tend to just x-ray the patient before they see them. It gives you such a good clinical picture of what you're going to work with. Even though we are trying to feel what's going on, but if you have that clinical picture, it helps a lot. So we can then identify maybe there's some degeneration going on there. That could explain the pain you're feeling around here, for example. So we love it if people bring their x-rays or even their MRI scans with.
Okay, and that's where we're going to have to leave it. Is there anything else of importance that you believe our viewers need to know as far as chiropractic is concerned?
I just think that everyone needs to stop being scared and maybe try it out once. Because a lot of people are scared and there's absolutely no reason to be scared of a chiropractor. I don't think I'm mean.
Desiree, Crystal, thank you indeed for being with us. I think you've dispelled a few myths for me, and I think I'm not going to be that hesitant any longer to consider going to a chiropractor next time around. Thank you for being with us, and lots of luck in your new practice.
Thank you.
That was Desiree Crystal talking to us about chiropractic, and as I've told you, if you haven't yet decided what you're going to be doing, perhaps after your gap year, here's a field of study you might want to consider. Thank you for watching this part of the show. Still to come, we're going to be talking Africa Teen Geeks. And welcome back. We're now going to be talking to the lovely Lindiwe Matlali. She's the CEO of African Teen Geeks. What on earth is this all about? Well, stay watching because you are going to be blown away. Lindy, good morning. Welcome to the show.
Good morning. Thank you for having me.
Lovely to have you here. And I think you are here to truly, truly empower and upskill the youth of South Africa. Now, when you use the word geeks, people often wonder, goodness me, what are we talking about? But African Teen Geeks is what is sorely needed in South Africa, am I right?
Yeah.
Because it is about science and maths.
Yes.
And coding.
And technology, yeah.
Okay. I know that you come from very, very humble beginnings, but you've truly carved a niche for yourself, and you are upskilling lots and lots of impoverished youth. So let's start right at the beginning. How does your story start?
I was born in Mpumalanga. My mom died when I was 4. So I was raised by my grandparents. And then my
they were poor. They were very poor, were they not?
They're very poor. I mean, when my mom and her sister died within 2 weeks apart. So my grandfather had to look after 7 of us, but also 5 of my aunt's kids as well. So he ended up with 12 young kids, and me being the youngest at 4. So it was really, difficult for him because he was a pensioner. And remember those days, the grant wasn't much at all. And he worked as a gardener, and he used to ride a bike to work because he couldn't afford to actually even take a taxi to get to work.
What was going on in your mind at that time? You'd lost your mom. Here's an old man taking care of 12 kids. There's barely enough food going around. What were you telling yourself? Because our self-talk really determines who we eventually become. What were you telling yourself at the time?
I mean, I was lucky that my grandfather was a very spiritual man. He used to pray a lot, and he instilled, the fear of God, but faith in God. And given that, he didn't have much, for example, when we were sick, he couldn't afford to take us to the doctor, so he taught us to pray. So he will say, pray for it, touch where you are sick, and then pray, and then he'll ask you, do you believe that God has healed you? You say yes. It's like, okay, so you're fine.
And
so
it
if
worked.
you believe, it worked. It
the
really
power
worked.
of positive
the
thinking.
power of positive thinking and that faith that we had. And so because of that, but also because he loved education. I mean, when I was in grade 4, he went back to school at night school so that he can learn to read. So he pushed that on us. I mean, he used to say to me all the time, if you went to school and you studied, you will never even remember that you were an orphan. And when I passed matric, I was one of the few who did really well. And he bought me a sound system, like a 3 CD player, which it was so, because he really, when I went to university, people actually thought I came from this rich family, because you come to my room, I have this big sound system, 3 CD changer, like pioneer there. People thought, wow, you must come from a good home. But he really, I think because of that, like education, so I was really used to push us, used to work hard. And I think that is what helped me, because I dreamt big. So I knew I was going to university irrespective of our circumstances.
You were dreaming big at the time because you told yourself you're going to break out of the shackles of utter poverty. Did you think it was, even though you were dreaming big and you had a very positive mindset, but did you ever along the way doubt that you're going to make it big in the world?
I didn't doubt that I was going to succeed, because I really, worked hard, but also because of my faith. That was like, I just always had this thinking that God had a plan for my life, and it was bigger than my dreams. So it was more like, I know that my vision is dreamt of based on what I see. And, what my grandfather used to say to me was that, God's dreams are bigger than yours, because he can see the whole planet, and you can only dream based on what is available to you. So if you put your faith in God, he'll take you to places you've never even imagined, because he knows where, he wants you to go. So for me, that faith was there. It was a really big part of who I am even now.
He sounds like an amazing man. Is he still alive today?
No, unfortunately, he died when I was doing my second year at varsity. And that was a difficult time, but also it ended up becoming a very, I would say, an inspiration, but also something that pushed me, because I didn't want to let him down. So as I wanted to have the degree, I wanted him, even if he wasn't there, but to go to the stage, graduate. I mean, I'm a perpetual student. Even now, I'm still studying, because I just feel like that's one thing I can give him one day, to become Dr. Matlaiti. So that's my vision.
Wow.
Yeah.
So what did you study?
I studied BCom. I majored in economics and stats at University of Cape Town. And then I went on to do Masters in Technology Management at Columbia University. And I'm going to do Masters in Innovation Studies at Wits next year.
All right, so that's your plan going forward.
Yeah.
How and when was Africa Teen Geeks born?
It was born in 2014, also accidentally, I must say, because my background was really business, because afterwards I started my own business. I was never really a geek at all, but I was overseas, and during the time there was a conference that was happening around MIT, and I went to that conference, and there was an 8-year-old girl that stood up and presented an app that she had created. I was sitting there so inspired, thinking, why don't we have that at home? And while she was speaking, I started literally Googling, computer science education in South Africa. And I was shocked by what I found. That obviously IT is taught from grade 10 upwards, but it's mainly in Model C schools because they're the ones who would have the teachers and also computer labs. And then I thought I wanted to come back home and start this and give children from disadvantaged communities and teach them how to code, but also, you know, take them and expose them to the world of technology, because I really believe that you cannot aspire to what you haven't seen. What we do, even if we teach the kids how to code, it was more about also exposing them, get them to visit a Microsoft, get them to visit a university. And then we partnered with UNISA, because for me, being a university was that a lot of these kids, most of them don't have anybody who went to university before to them, and they think that is something they cannot afford, so they don't want to dream because, you know, you're going to be disappointed. But taking them to UNISA, just being in that environment, I've seen is really one of the things that have encouraged these kids and pushed them and say, okay, I want to study, I want to go to university as well. This is where I want to be. Yeah.
Mm-hmm. Yeah. How many doors did you have to knock on, and how difficult was it? I can imagine you must have been turned down plenty of times. Did that break you at all?
No, you see, that's the thing. I think sometimes your background, you know, you think is difficult, but it prepares you. Nothing in my life was easy. So I actually feel I'm comfortable if things just fall into place. Like I'm like, okay, was there something wrong? What's the catch? Because I'm used to working hard for everything that I have. So a lot of the doors that were, you know, shut in my face, or people who didn't want to support me, didn't see. For me, it really didn't discourage me. You know, I had this kind of a where it's like, I must show them, like, you know, Mr. and Mrs. I must show them, like, okay, it's fine if you don't see, but I'm going to show you that I can do this. So that's what really pushed me. So, you know, when we started our first computer science week, we didn't have anybody to fund us. So that money came from my money, my husband, and like, yeah, I'll pay you one day. These kids were, you know, when you see the kids, and really, that's really, we had to bootstrap because I really believed in what we're doing. But also once you meet the children and you see just the first lesson of them sitting and making, you know, a sprite jump or just writing that code, and you see the excitement and they are, you know, wanting to learn more. For me, that's really what has really inspired me more to say, I'm going to do this, whether we get the support or not. If it means we raise money from our own pockets, we will do that. And yeah, so...
I'm talking to the lovely Lindiwe Matlali. She is the CEO of African Teen Geeks. And after this ad break, we're going to unpack exactly what Teen Geeks are all about and how you can get involved if you so wish to. We're talking to Lindiwe Matlali from African Teen Geeks. It's an amazing concept. I kind of wonder why did someone else not come up with it. She's now the CEO of the company and doing amazing work at the UNISA labs. Now, you told me before the ad break that you knocked on many doors and of course you were turned down, or you were kind of told that it's not part of our strategy now. So these were big companies. You probably even went to government, education department, etc. When did someone, or when did UNISA see the merit in what you were doing and gave you the green light to go ahead?
Actually, from the beginning. You know, from the very beginning, we went to UNISA. At first, we started by saying, can we bring kids for Mandela Day? And the children came and they didn't want to leave. And they're like, so when can we come back? When can we come back? I said, okay, well, I don't know. You know, then we went to UNISA and said, well, you know, the kids are here and they really love the program in terms of, you know, they're excited about it. Can we do more? And then for that year, for 2014, they're like, okay, maybe we can do Women's Day. So we brought young girls as part of Women's Day to get them exposed to tech.
Okay, now you're talking about, what we're talking about now when we talk about the program, we're talking about coding.
Yes.
So you expose these kids just once off one day to what coding is all about. But for it to continue to make something out of these kids, for them to go on to become a presence, you know, in their own lives, or a presence, they could go on to bigger and amazing things in their lives.
Yes.
Let's understand what is coding and why is it so important in today's age, in today's world, for people to understand what coding is and perhaps learn the language of coding.
Yeah, I mean, at first it used to be once off because that's what we had. But because we didn't want the touch and go approach, we then extended the program to be now, a child can start and attend classes every Saturday at UNISA. Coding is basically learning how to write a computer program. It's about computer programming. So we teach them to be not just to know how to use a computer, but also to be part of the people that can create content. So because it's not just about consuming technology, but we want them to also to be creators of technology.
So what sort of age group I'm looking at the criteria of the type of child that applies for this. We do know your target audience is very definitely disadvantaged communities. But what sort of exposure should the child have had to be able to embrace the concept of coding wholeheartedly?
None. We just want them to know how to read. So we take them from grade 1, as long as the child...
Grade 1?
From grade 1.
Wow.
As long as the child can read. Because then it's easier for them to read the instructions. And also what it does for the kids, actually the younger kids, they start learning to read with understanding. I mean, we just had the stats today that a lot of our kids from grade 4, we came last because our kids cannot understand, comprehension. Coding does that. We tell them that, you need to write a code that can do this. So they need to understand what the instruction is. So they learn that very early on. And as they grow, some of them, they start and they're struggling maybe with the reading, not understanding. But within 6 months, those actually become one of our best kids. So when we had 2 hackathons this year, the youngest child was 7-year-old. So and
what is that?
A hackathon
yes.
is when you bring kids, people who come together to code for 48 hours, non-stop, and to solve a specific problem. And they have to leave and present a working prototype. So to say, like the hackathon we had, the last one was with Hacking for Justice, which we did in partnership with the United Nations Office on Drugs and Crime. So we gave the kids, they had 4 themes, like from terrorism to cyber crime to, corruption, and they to understand those concepts and then come up with either a game that can prevent or teach other children about the dangers of getting involved in crime. So the kids ended up putting together basically a basic prototype of their game. A lot of them did quizzes, some did apps, at the end of the day, but that has to be done within 48 hours. And the kids, they really, really did well. So it's been really for me, so amazing. I mean, the last one we had with even the guys that came from UN, from Vienna, they were so inspired to see, one, how disciplined our children are. Because, we teach them one of the skills we teach them is not just about coding, but research. So they have to go and research about the topic that they're doing. And also, they have to figure it out on their own. We teach them to learn to solve problems, stay with the problems until you get an answer. So before they come to us, if they raise a hand, it's like, what's your problem? They're like, okay, I Googled it, I checked, there's no video on YouTube, and then now we need you. But we tell them they need to basically exhaust all the resources around them before asking for help.
I'm also thinking as you speak that these children all of them may not necessarily go on into the world of IT, but the skills that they are learning in this process, because you're talking problem solving, you're talking about skills where upskilling them in different facets of life, that they can become very well-rounded individuals, whatever they then decide to go on and do.
Yes, I mean, everything we do right now requires technology. Even from where we are, the set all works based on technology. So if you end up being a teacher, you have to teach now. We're moving to, like in Gauteng, we know, with the paperless classroom, you now need to teach with technology. How will you teach with technology if you don't understand it? But also, if you are a nurse, you have to use equipment. Everything works on technology. And for us, we want to teach the kids to be innovative. So to learn and realize that technology can help them to make wherever they end up to be more effective. So, with the doctors now, actually I was watching this show, The Good Doctor, and when you see how much technology is being used in medicine, who does that? You know, it has to be doctors working with technologies. But imagine if you are a doctor and you know how to code. So you can create these systems as well and be innovative in whatever industry that you end up in.
And when we talk coding, the kids, what you did indicate is that they must be able to read because they need to understand the instructions. What about science, math, science and arithmetic? Do they need to know that, or is it just wanting, is this a concept that they can embrace just by understanding how to read?
One of the things with coding that, you know, which I think is very interesting, I mean, there's been research to prove this as well, that coding also helps kids who know how to code automatically end up doing well in math, because coding is very systematic. It's about logical thinking. Everything is step by step, and you cannot skip a step. So those are things that you need to learn as you solve for X. So if you already have the understanding and knowing how to think logically, it's not going to be difficult for you to understand the Pythagoras theorem, because you already, you know, you're thinking, you already taught or used to working in a way where you solve problems but in a logical and structured way, which is really what math requires, a skill that math requires.
Children or parents watching us this morning who would love to get their kids onto this program. Obviously, the new program, I should imagine, starts in the new year.
Yeah.
What is the criteria? I do know you started out in focusing on disadvantaged children or children from disadvantaged backgrounds. What about a child in Model C school? And you did indicate that from the age of about 6, when a child can read, would be a good time for the child to enter the program. Mm-hmm. Would you look at children from other backgrounds, advantaged backgrounds, because they want to take advantage of this amazing concept that you're offering?
No, of course we do. I mean, I think for me, computer science and coding, I think every child now in South Africa, unless you go to the few expensive private schools, they don't teach coding. Actually, a lot of private schools, some of them don't teach coding. So those kids are also disadvantaged, so you know, so maybe they don't want to be labeled like that, but when it comes to computer science, a lot of kids in South Africa are. So we want those, they can reach out to us. I mean, we help them, we train the teachers, through our teacher training program, and then we then will help them to implement the curriculum. We are an Oracle Academy Institute, which means we can get the kids to basically learn Java. And we also do Java from very early on. I mean, my 7-year-old child already knows how to code, on Java. So they can reach out to us, and then we can be able to assist them in either implementing the program at school or starting a gig club in your community. I mean, in some of the advantaged community, the kids will have computers. So maybe somebody can bring them into, one home every Saturday or whatever, and we can help them to then teach the curriculum or bring somebody that can help them if they need somebody with technical skills at the beginning.
That sounds absolutely amazing. It's really a wonderful opportunity to upskill the whole of South Africa. If we go that route, little communities can starting their own little coding clubs. Mm-hmm. So here's a way one can put back into the community and uplift the entire South Africa. In terms of costs, are there any costs involved?
Our programs are free. And the only thing we ask for, those who are advantaged is if you can support another child with transport and maybe lunch, that will be appreciated. That's what we ask for, because we are a non-profit organization. For us, it's about getting as many kids to learn how to code as possible. And as I said, because some of the kids that are advantaged don't have the resources. So what would help is that if you have a child in your advantage, you can afford to pay for another child from your nearest township to attend the classes, then that's all we ask.
So as we speak, how many children and at what age groups are they? How many children do you have in your classes across South Africa, and the age groups? Our youngest child is 6-year-old, but this year, at the end of this year, basically with the Saturday classes that we had 480 kids that were attending Saturday classes at the 4 campuses. UNISA
campuses, Pero, Durban, Sunnyside and Florida. Next year we are extending that as well to other areas, Rustenburg, East London, and PE as well. So and Pietermaritzburg. Where kids can also be able to come. And then we also run Computer Science Week, where there's basically introduction to coding, where parents just bring their kids for a day. For that, we have reached around 12,000 kids. So in total, I mean, since we've been around, we have reached just over 38,000 children that have been part of our program. Next year, we targeting to have 1,000 kids that will be part of our Saturday classes. But with the Computer Science Week, we want to reach actually 20,000 kids, but also because we do that twice a year, so in total 40,000
and
kids.
All this will happen on the UNISA campuses.
All UNISA campuses, yes. And we also next year we're going to be in other schools as well that have reached out to us, and so we have our first teacher
hold
training.
that thought. Let's pick up on that right after the ad break. Lindiwe Matlale from the Teen Geek Club is here talking to us about the most amazing concept which has been introduced in South Africa. She has reached out to the disadvantaged communities, but this is something that is huge. It's going to grow even bigger. And for those families, teachers and schools who are watching us this morning and believe that this is something you need to introduce, you don't believe that this, I think this must be introduced in all schools throughout South Africa. I think you need to get in touch with Lindiwe and let her help you set this up in your schools. And for parents and community leaders, maybe you want to start up these Saturday clubs in your communities, and together let us uplift and upskill the entire South Africa. Stay with us. We'll be back with you in a short while. And my guest has just blown me away now, because she's told me off air that she's been nominated as one of the top 50 women in South Africa, top 50 most inspirational women in South Africa. Now, is that not a big deal? And I'm going to ask her to tell us about the other nominations that she's had, and then we'll continue talking about African Teen Geeks. Congratulations. I hope that, you know, even if you're not chosen as the winner in that category, the fact that you've been recognized as being in that specific club or that specific group of people or women, I think that in itself is recognition for what you've done. So congratulations on that.
Yeah, thank you.
I believe that you've been nominated for other awards. What would those be?
Yeah, I mean, the top 50 were, I was one of the women, top 50 most inspiring women in tech in South Africa. And also the Destiny magazine, Power of 40 under 40 powerful women. And I mean, like, and the BBQ magazine, Community Builder of the Year. But I think we just now been nominated for the ITU and UN Women Equals in Tech Award, which are taking place on the 19th of December in Geneva. I mean, for us...
And you will be attending?
Yes.
Oh, brilliant. And, congratulations.
I mean, for us, whether we win or not, I mean, it feels like to be, I mean, they said, like, you know, selected us from top 5 out of the 300 organizations worldwide. It's really, really, you know, a huge, you know, basically recognition for our work.
Absolutely. We'll be holding the flag very, very high for you. Please do come and talk to us when you get back to tell us how it went. But like I said, just being recognized, you don't have to take the top spot, which I'm sure you will, but just being recognized, that in itself is an accolade. So congrats, we're very proud of you. Now, for people watching us and who would like to get their kids to enroll for next year, how do they go about it?
They can email us on info@africateengeeks.co.za or go to our website, www.africateengeeks.co.za, and send us a message there, and then we will send them the required information.
All right, the operative word there is teen geeks.
Yes.
But that doesn't rule out older people, somebody who's missed their calling in life, or perhaps a housewife or a teacher who would like to introduce this concept at their school or their community. They can get in touch with you and enroll for a cause as well, and take back almost like the train one, or each one teach one, that concept, and then take it back into their schools or their communities?
Yes, I mean, we do ask for schools to actually reach out to us, because we have a teacher training program, which is actually run, we're supported by Oracle Academy, and counts for 30 CPD points. So if a teacher comes and attends, those points count towards their professional development as well. So we're hoping that schools that do have the infrastructure can reach out to us, and, you know, we train the teachers and they can run the
Great. I have a school that I'm going to refer on to you, and their teachers can come on board.
Yes.
That being said, let's talk about highlights and challenges in your life up to now. So you're 3 years in the running. You've had to knock on a lot of doors, but there have been some amazing people that have come out in very full support of you. We've mentioned the one, and that is UNISA, who have offered you their facilities, their labs at no cost. Who are your other benefactors?
I mean, SABC Foundation have really been supportive from the start, where they've been giving us free publicity, you know, on all their radio stations, giving live reads, interviews, tweets, and Facebook posts to encourage children to come and attend our program, which has really been amazing in terms of...
And just put our name on that list as well, ITV Networks.
And ITV Networks, yes.
Absolutely.
Yes.
Hopefully by way of this program, we're going to have a whole host more people joining you, schools and individuals as well. Challenges, how have they been? Have you ever felt at any point in time, I can't do this any longer because it's just taking way too much out of me, or too many doors have closed in my face?
Yes, I mean, it has happened. Like, as I said, when we do computer science week, with the number of children that we have to reach, and not having a sponsor, and us deciding we're not gonna stop it just because we didn't have a sponsor, and finding ways to get money, like, you know, I've had to use my own money many times, and get loans from my husband many times to get him to fund and for us to provide the transport and the food for the kids, because it's really it's about the children. And I think is that when you see them, when you see, you know, a child coming at the beginning, they don't even know how to touch a computer, they're scared, and you know, fast forward 6 months, this child is already telling you that they are the next Mark Zuckerberg.
Wow.
But they really believe it, because sometimes it's like you see that this child really believes it, they're inspired. And I think that's inspiring for us too, because it's about raising aspirations. If we can change one child's life, I think we would have, you know, really done a
Okay,
great
Lindy,
job.
here's a question for you. There are special needs schools and children with certain different, you know, certain disabilities. Would you open doors to them as well?
We do.
Because I'm thinking there may be a disability, but there may be loads of potential in those schools and with those children.
Yes, I mean, we do. I mean, I've been actually doing a lot of research now around helping autistic kids. I don't know, I have this you know, passion for kids who are autistic. I don't know, I find them so beautiful and amazing, and you know, and I think one of the things that a lot of these kids cannot communicate, but I think through technology they can be able to communicate and create a lot of creative things.
So there's absolutely no barrier to entry.
There's no barrier to entry. I mean, I think one of the issues that we have, though, for example, is that it will depend on whether, like, the UNISA lab that we have has proper you know, for kids that are there coming on wheelchairs, but the Florida lab definitely does. You can take a lift, and they have proper rails for that. So we don't discriminate. I mean, I'm like really, as we speak, looking at also programs for kids who are partially blind and see how we can help them, because there's a lot of those programs internationally. So we reached out to one university that has been doing that, the University of Washington, to see if they can help us to see how we can create those programs for those kids as well.
Okay, so you're 3 years in the running. Thousands of kids have, you know, worked through your lab, and you're hoping to take on thousands more. Can a kid who started with you at age 6 kind of stick with you for the next 10 years, perhaps?
Yes, I mean, we've structured our program in a way that when they start, we teach them, they learn the basics of coding. And then now like next year, they move to learn robotics. And then we are introducing also, I mean, we got a couple of 3D printers because we want the kids to start now creating actual programs or actual, technology, even if it's like a camera, like my child was looking at creating a indoor camera and print them through 3D. So we want them to start like making stuff now, and how can they make hardware or technology kind of programs as well. But also there's artificial intelligence, and we're teaching as they grow. There's a lot in technology that the kids can learn. So for us is that I would like if we have a child that studied with us by the time they're 6, my hope is that if they go finish university and they choose to do computer science, I would like them to move to 3rd year because they've done everything from 1st and 2nd year.
Oh, wow.
That's really
so that's the plan going forward.
That's the plan because I mean they can learn. I mean, as I said, like the kids are doing really, really well.
That's for the children. Future plans for the CEO of Teen Geeks.
I think right now the most thing for me, I think I would like to have my PhD before I turn 45, so there's not a lot of time. So I have to work. That's really what I would like to achieve. Yeah.
And in growing the Teen Geeks Club?
We are. I mean, my vision is to get the program into schools, and we are getting there. So we're getting traction with the Department of Basic Education. I mean, we already got the support in Mpumalanga, where we're working with the Department of Basic Education there to get it in schools. But with the national department, we're also getting traction and support. So my hope is just basically working on assisting in developing a curriculum that will be ours. I mean, next year we'll be launching our very, very own coding platform and a comic book that for children, from 6 to 10, grade 1 to 4, that they can read and go to our platform and code the challenges that the kids are solving on the books. So these are the thing where we're also trying to make our very own content, but that kids can relate to. I mean, the storyline, the names are, we've got basically the rainbow nations in South Africa, even a Rajesh. So even some of them.
Okay, so in closing, if you want to give a shout out to anybody on the show this morning, who would it be to and why?
I think, unfortunately, he's not around, but for me, it would have been to my grandfather. I would just say to him, I did it,
Oh, wow. Good on you, girl. Yeah. Good on you. You go, girl. You go on touching lives in a very positive way. And to everybody watching us, what's your final words of encouragement on the show today?
I would like every parent out there, if you have a child and your child doesn't know how to code, please, I would like you to bring your child to learn how to code, or just reach out to us. If you can teach them yourself, we can help you with all the platforms that can help the child, because technology is really the future, and they don't have to. We're not saying encouraging kids to all be computer scientists and be software developers.
Engineers,
irrespective of where they go, technology, we would like them to be innovative. And I think technology is one area where they can really be innovative and fast.
And thank you indeed for being with us. We're going to be watching you, and we're going to be watching you when you go and receive your award at the United Nations. So good on you, go well. Thank you indeed, and please keep that flag flying really high for South Africa.
Thank you.
That was Lindiwe Matlali, the CEO of African Teen Geeks, amazing woman with an amazing story, and she has truly lived her dream. She's uplifting South Africa, the entire South Africa. So let us band together behind her, and let's get our communities, our schools and our youth as well involved in African Teen Geeks. And that brings us to the end of the show. A big thank you to the production team. Until the next time, as always, please take care on the roads. It is silly season. People do the craziest of things. You be the responsible one. You be more Muslim. Until the next time, as always, it is Khuda Hafiz from me, Julie Alli.
Ya hala, 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 حن قلبي على جمعة الخير هلا، حن قلبي على جمعة الخير هلا، يا هلا ويا هلا ويا هلا ويا هلا، يا هلا ويا هلا ويا هلا ويا هلا، يا هلا ويا